Hello and welcome to Our Experts Podcast. I am Carol Matichka, your host, bringing you fascinating perspectives from the world and realm of pharmacy. Well, hello. Today we have with us Michael Mezzano. He's the Assistant Director for the Center for Convening Transformative Care here at UF Health Jacksonville. And I just want to welcome you today, Michael.
Yeah, thank you for the introduction, and thank you for having me. I appreciate it.
Absolutely. So before we start, CCTC is how we know it as. So talk to us about how this came to be.
Yeah, sure. So in 2023, at the tail end of that year, they were accepting grant proposals from the University of Florida, and this is one that Dr. Kelly Gray-Urim submitted. And she's our Chief Quality Officer, so she had this idea of, we have all of these wonderful programs happening across the College of Medicine, the College of Pharmacy, the College of Nursing, not to mention the hospitals and our clinics, freestanding EDs. And, as the Chief Quality Officer, she sees how those really can help each other and intersect with each other. But oftentimes, there's a lot of parallel care happening. So the goal of the CCTC is essentially to link those together, to convene the care that they're already doing together, and to then, on top of that, sort of expand. Once we make those connections, how can we really leverage them and amplify what's happening? It was an initiative that was approved by then President Ben Sasse, with a grant from the university of about $1 million to fund the center over a period of years. So
it's fantastic. And you think about how much our community needs us and how much we can do in the community and really to improve healthcare in general. So this is just a fantastic opportunity. And I'm hoping we'll see something like this spread to other communities as well. So,
absolutely.
So, just to get us started on you, we'd love to introduce the audience to you as well. Tell us a little bit about yourself. How did you end up in this position?
Sure. I always like to start by saying I'm a Jacksonville native. So I was born here, lived here my whole life, 33 years now. And so I've always, really been connected to the city. And when I finished college at UNF, got my AA at FSCJ, got my bachelor's at UNF, so local for college too.
Local bred, yeah.
I went into teaching. So I was teaching in our public schools, and I started at Terry Parker, also taught at Atlantic Coast High School. And when I was, in that profession, on the daily, I was encountering students who were dealing with problems that, not just impacted their education, but also their everyday life. And certainly I had students who were dealing not just with things we think about, teenagers struggling with, but, health and medical issues too. Mm-hmm. I kind of think back as that was the peak of the what I think of as like the energy drink epidemic, where a lot of my students would get through their day just on Monster or Red Bull or Celsius.
Oh my gosh. Unfortunately, that's still the case for
yeah,
students.
Exactly.
Yeah.
And so you've got those kind of, health literacy issues of do they understand what nutrition is doing for them, but also, lack of access to care and things like that. Mm-hmm. So being faced with those every day as a teacher, you're not just teaching algebra, you're a counselor, you are a sometimes therapist, you are sometimes a resource navigator. Wow. And so when I left teaching to go into data science, I was really fortunate to have a course that engaged in research. And that kind of led into an internship with UNF called Florida Data Science for Social Good, where I was involved in research specifically on the healthcare gap in Florida. And after that, I kind of knew that whatever I was going to do next, it had to be something connected to the public good. And coming from that exercise in, healthcare and health insurance, I was really fortunate that this opportunity was available. And so that's how I ended up here. And at that time I was hired, I was the data management analyst. And over this summer, our assistant director, Ashley Emmons, left to pursue some amazing opportunities overseas. And after a selection process, I was very thankful that Dr. Gray and the steering and operations councils decided that I was a good fit to continue that work as assistant director.
That's great.
So a little bit
Glad
verbose,
to have you here.
but
no,
thank you.
That's okay. And I love your background as a teacher because I think that is so important in regards to what we are doing here as well.
Yeah.
And you're right. Teachers are amazing. They see everything, and they really are a lot more than just a teacher. They, like you said, social worker, et cetera, just really helping in that regard. So
absolutely
fantastic background. So talk to us about our community here at UF Health Jacksonville, and why is CCT so important to be a part of it here?
Yeah, I think, as a health science center, we really have that unique environment of not just having people who practice medicine, but those who are learning to do so. Mm-hmm. And of course, we're all still learning as we go, right? But we have students who are working to become those professionals. Right. And, in my mind, coming from education, that's the most valuable thing, right? Is when you have a medical system that is focused on not just healthcare, but how do we improve healthcare? That's crucial to improving outcomes for your patients. And so in my mind, what the CCTC serves to do is it links together these systems of the colleges, the hospitals, the clinics, our freestanding emergency departments. And there's so much work that is to be done in each of those silos. Like a lot of times people describe them as silos.
Sure.
And so I think that the power of a center like this is, everyone is busy and tuned into the work that they have to do that's so critical. And so having an apparatus like this to say, hey, I see what you're doing here with pain management. I think that this would be a great opportunity not just for pharmacy, but also for nursing to get involved. Or with our sickle cell patients, we can think of that not just as treating pain crises, but how do we leverage every part of the system to help those patients have better health outcomes? And so it's almost like, connecting those silos so that rather than just leaving the emergency department with a referral somewhere else, we're really tuned into the pathways that those patients will take or could take. And that's the transformative part of our name, is how do we take what we already have, bring it together, and transform it into something more than just the sum of its parts.
Which is absolutely so imperative, I think, and so important for our patients, because, it's very challenging for patients to come to a large academic health science center like ours and have a certain disease state or have something that they're dealing with and try to navigate with the different systems of everything that's going on. So for us to be able to find them the different pieces that can help them with that, but then help them as a whole, which is really ultimately what CCTC's goal is, to help them as a whole and to make our community better and healthier. So I think
just
that's so
to
unique.
That, I think another part of our unique community here is, we serve patients who are on Jacksonville City contract. So those are patients who don't have access to, private health insurance or health insurance through work, or they can't afford any of those options. Right. And when you think about a lot of the health systems in Jacksonville, I think that's really the most unique thing about UF Health Jacksonville, is that we do serve that population. And it's not just a matter of treating patients that come through our doors, but also being able to reach out to those patients who, whose social drivers of health, create so many barriers to care. And I think when I think about my job and what I'm doing, that's usually the population I think about first is, how do we improve care outcomes, not just for all patients, but help those patients, get the care that they need and remove those barriers and make it easier for them to navigate through our care system.
Right. We can have the best intentions and the best of care, but if they can't get to that or aren't sure where to go, that can be really challenging. Yeah. Is there a specific project that you're working on right now or something you'd like to share in regards to how we're helping the community?
Yeah. One that we're kind of wrapping up with, and now I think of it as it's in the promotional phase, is we worked on this fruit and vegetable prescription. And it's really simple. It's actually based on an order in Epic that was created a few years ago as part of a grant-funded project to help providers give patients a easy-to-follow script of food. For whatever health condition they might have, healthy eating we know is important for so many conditions, whether
Absolutely.
heart disease, diabetes, just obesity in general, which is connected to so many other conditions.
Sure.
And so we saw that this order had a lot of use in past years, but in reviewing it, we saw improvements that could be made. How can we make this easier for patients to understand when they're at home reading it on their own? How can we make this order easier to bring to a food bank where someone at that bank can read this and help select the best options for that patient? As well as, if we have patients who live in food deserts where maybe the closest grocery store is a 15-minute drive and you don't have a car. Some options to help them where it's like, well, if your meal today is going to be at McDonald's, well, what can we see from their menu that still helps you meet your health goals?
Sure.
So really just trying to frame that order in the reality that patients are living in. And so we actually leveraged one of UF's new tools, Navigator. It's an AI system that is in-house at the University of Florida. And we essentially prompted and worked with the system to say we'd like to transform this order for a second to third grade reading level so that no matter where someone is at, they can understand it. We'd like to have options for fast food or gas stations or folks who are in those food deserts.
Sure.
And we'd like it to be easy to understand in terms of measurements. So rather than saying, eat a quarter cup of kale 2 times a week or something.
Right.
A fistful, a baseball-sized amount of this many times a week. And so we were able to implement those changes, and we're bringing it to our directors of community health and family medicine. We're bringing it to our residents, and we're really hoping that this will provide them a tool that allows them not just to help patients understand, but helps them communicate with the patients too.
Sure. And it's looking realistically at what does somebody deal with. We'd love for everybody to be able to have these salads every day and this amount of food and make things that sometimes are rather challenging. I will tell you, some of those meals that are out there, they're talking about all these different spices and things that people just aren't even sure. So keeping it as simple as possible, keeping it in their reality, I think that is absolutely fantastic. And I think that helps with the patient provider relationship as well, so that they really can meet them where they are. So that's fantastic.
Absolutely. And I think, I have 100 projects I could talk about, but something with the convening part of this is in that context of just that order, we also try to talk about things like Find Help. That is a free website that we contract with here at UF that helps patients and providers find resources like food banks, also things like financial or housing assistance. And so, kind of framing those two together of if a patient does bring that up, I'm not sure where I can get this stuff. Find Help is a really easy tool for providers and patients to go in there, their zip code. If the provider's using it in Epic, it actually auto-populates from the patient information. So their zip code is in there already, and it kind of helps align with those social drivers of health. And, not just Find Help, but we have a food pharmacy here at UF Health, Jacksonville. And it's funny, sometimes I'll be in a meeting talking about these things, and I'll have one provider in that meeting ask, I didn't know about that. What is that food pharmacy? And another provider at the table will, explain what that is and how it works and how patients who need that assistance have that resource here. And I think that really speaks to the work of the CCTC is educating internally and externally of we have these things, we have these amazing programs to help our patients. It's just about getting the word out there and creating those care pathways so that it's, easy as clicking a button and your patient can have one of their needs met.
That's so great. Because there are so many different programs sometimes I think that are out there, and one person may know about this one, this person knows about that, but trying to connect everything is so important for the providers, but also for the patients. So.
Yeah, exactly.
So Many of our listeners are certainly pharmacists, but we have other listeners, healthcare providers as well. And we all know that healthcare doesn't happen in a bubble. It's not in silos, as you've been talking about. How does CCTC work to really engage the various professions in the community, bring them together to work on some of these projects you're talking about?
Yeah, I think our most powerful asset is our operations and steering councils. A joke I always like to make when people ask about where I work in the department I'm in, is I say, I am a very dedicated workforce of one employee in the CCTC. But truthfully, a lot of our power comes from those councils. Yeah. And, the members of those councils include you, Dr. Matichka, and representatives from all of our colleges of medicine, pharmacy, nursing, as well as from the hospitals. Dr. Gray is not just our chief quality officer, but she's also works in the ED. So when we have those meetings with all of these really key stakeholders and leaders, that information sharing, I think, is the most powerful thing about this center, because the conversations that people have of maybe we're talking about something with pain management, right? Just to use an example. And someone at the table kind of might casually bring up something that happens in the College of Pharmacy for pain management. PAMI is a great example of a program that we work with. Yeah. And that could be, someone else's first time learning about that, or really having the chance to get the nuts and bolts of, how does this work? How are patients referred to it? What does it look like once a patient has entered that program? What does it look like afterwards? And creating that awareness of these programs that those leaders can bring back to their colleges, to their facilities, and then to collaborate and say, well, how can the College of Medicine help? How can the College of Nursing help? I think that truly is the biggest asset. And especially as someone who comes from a, educational background and not a medical background, every time I sit in that room, I am just amazed at what happens when those connections are being made. So truly, we underestimate how powerful just conversations can be.
I completely agree. I've learned so much through CCTC and through the interactions, and it's been great for our students to be able to give back and to find community engagement opportunities as well. So absolutely, very powerful. Really, really excited about our care that we're able to provide through this. So, are there any upcoming projects that you're looking to engage in, maybe that we're not engaging in yet, or something exciting we can look forward to?
Yeah, I don't want to give away too many details because we're still kind of in the blueprint planning phase. But our roadmap for 2026 is really looking at how do we take the connections and the groundwork that we've done so far, and how do we create initiatives that really wrap in everything that we have kind of cataloged here. So we have, our faculty in the colleges. We have our providers in the ED and the clinics and the hospital. We have our students, which coming 2026, we're going to be seeing even more students coming to Jacksonville.
Yes, that's very exciting.
And so and we have our community partners as well. And so really we're looking at an initiative that says, we recognize that so many of our patients have those barriers, not just to care, but to accessing care and to health education and health literacy. I really think that, nowadays, one of the biggest things you can do for someone in healthcare is just talking with them and addressing their, what they don't know about health. About how to take care of themselves, about how to seek treatment. And so taking that out to the community in a really structured, bi-directional dialogue of not just, hey, we're the experts. Here's everything you need to do. Eat your greens, eat your beans.
Right.
But saying, what are the health problems that you feel you're struggling most with?
Yeah.
And convening around our populations, our communities, with faculty, with providers, with students. I think that this project has a lot of potential to better serve our patients by meeting them where they are and not necessarily just waiting for them to come through our doors, but going, to where they are, walking through their doors and being able to really help bridge that last mile.
I agree. And I will say that it's almost we're at the point where there's information overload for a lot of our patients. There's a lot of information out there, but how do you navigate that and really narrow it down and figure it out? And so us as healthcare providers and going to them and really helping them take that first step, even for some of them to come into our doors eventually, I think is so important, because there's a lot of sometimes concern or they're nervous about taking that first step of seeing a provider. And so us going out in the community, I really feel like this is going to be huge and have a great impact. So
I think just exciting. Like you're saying, building that trust now more than ever is, I think, the biggest part of healthcare is when you have the internet and social media and you have 100 different people a day telling you 100 different things about, this is what's good for you, this is what's bad for you. Just meeting someone face to face and, asking them, what can I do for you? What are you struggling with? And outside of that office setting even, I think that's really how we work to rebuild trust and again, just to use the name drop, because I really love the name of the center, to convene that care and transform it, not just in our system, but for those patients.
It's really about relationships, right? It's that patient-provider relationship, much more than just the information we're providing. And that's so important. And sometimes you have to go out into the community to build that relationship. So.
Yeah, absolutely.
So with the holidays right around the corner, is there anything that CCTC is doing at this time of year? Anything that maybe our listeners or any of us can help with?
Yeah, right now we're kind of making an end-of-year push to get the word about our that fruit and vegetable prescription, and especially Find Help out there. The holidays, a lot of people think of as this time where everyone can gather together and have a big meal at the table and share gifts. And for a lot of people, that's just not reality. They are struggling more than ever during the holiday season because of, expenses, maybe travel expenses, maybe trying to provide gifts for their kids or their family. And, a lot of folks don't really know what to do because it can feel bad to talk about that sort of thing in a season where everyone is giving and filled with joy and cheer. I think that a resource like Find Help especially is so useful at this time of year, and just letting our patients know about it, letting providers know about it to spread the word, even letting my friends and family know that this is a resource, because I think it's a lot more empowering to say, hey, this is a great resource I just found out about. You can find anything on here, and putting that into someone's hands so that they can leverage it on their own. That's so much more empowering and respectful of someone, rather than saying like, hey, I know you don't have a lot of money right now, so here's a resource for financial assistance. But just kind of having that tool and saying, I found this as a great tool to help with all these things. I've used it before to locate services, removing that stigma. I would say that's kind of our holiday mission. That's great. How do we address those problems while still, allowing people to keep their dignity in a season that is so focused on oftentimes just, pretending like things are okay. We know as medical professionals, mental health is something that can be a struggle for a lot of people this time of year. So really just being there for folks, letting them know where they can get help on their own terms. I would say that's our big mission.
That's great. And where do people find help?
Yeah, so it is thankfully very easy. It's just findhelp.org. If they are coming to UF Health, their provider can pull it up right in their chart. And if they're curious about specific programs that UF Health has kind of connected with, you can go to ufhealth.findhelp.org.
Okay, great.
And I'm sure we'll be able to put some links in the description, things like that.
Sure.
Awesome.
And there are a lot of, and I'll put those in the show notes. There are a lot of services on there, just so people know. So take a look at that. Provide it to family, friends, loved ones. Absolutely fantastic way to connect to these services. So hopefully this will help get that word out as well.
Yeah, I hope so too.
Yeah. Well, Michael, is there anything else you'd like our listeners to know before we end?
Yeah, I think just to summarize everything we've talked about, this department is all about convening and connecting people together. And that's a really useful thing to have in a large academic hospital system.
Sure.
But it's really important that we remember in our daily lives how much we can do by just connecting to people around us. And, something that I think there's kind of a wave happening at time of recording, December 2025, of people starting to realize the value of community, of local connections and those face-to-face interactions. And so for anyone listening, whether you're a student or a provider or just an avid fan in the community, keep in mind the power of those connections and what just a simple face-to-face conversation, how life-changing that can be for someone.
Couldn't agree more. Well, thank you, Michael, for coming on this show. This has been fantastic. Thank you for all your work in helping in the community. It warms my heart seeing people like you who are so, that is your main focus, is really being such a huge part of the community. So thank you for all of that.
Well, thank you, and thank you to you and all the other doctors who do the work I can't do. We can't do it unless we do it together.
It's a team effort, right?
Absolutely.
Okay. Well, thank you for meeting with me today. And for all of our listeners out there, we appreciate your support of the show. If you don't mind subscribing to the podcast as well as the YouTube channel. And happy holidays. Merry Christmas. Take care, everyone. Bye-bye.